Hi class, my name is Rachel. This is the first time I am recording the lecture to go along with the PowerPoint, so if it's a little awkward, I apologize, but I promise I'll get better as I do more of these. So welcome to Phlebotomy. This is part of Healthcare Training of Kentucky, one of their programs. This is week one, part one. We're going to discuss the fundamentals of phlebotomy, the history of phlebotomy, professionalism, confidentiality, communication. We're going to talk about some safety stuff in some of these lectures before we get to the lab on Friday. I'm excited to meet you all. So let's get started. So phlebotomy has been used for a very, very long time. And as you can see on this page, we're talking about the Stone Age, they used to use crude tools. So that just means like whatever they could find to cut the vessels, drain the blood, like sharp stones, those kind of things, because, they didn't have metal yet. And then in Egypt, they have paintings that show where they use leeches to perform bloodletting, and we'll talk more about the leeches and how they're still used today in a little bit. This term here, venesection, that's an important term for you to know. It means cutting the vein to bleed the patient. Definitely an important term there. And I'll try to, as we go along, point out information that you should definitely take notes on, that you should remember, okay? Then we go on to the Middle Ages, and we had barber surgeons performing bloodletting and leeching. And I don't know if you've ever seen the movie Sweeney Todd, I think it's called, and he's like kind of killing people. That kind of leads back into people when they were sick, they thought that when they got sick, it was bad blood or an excess of humors. And the remedy for that would be to release that blood, let it go, get rid of it. So they would go to these barbers. That is historically why the barber pole is red and white. It represented the blood of the patient. It's let people know that's where they could go. So they would cut the patient, usually, in a big vein or an artery, um, which often led to death because they would bleed out. But the bleeding bowl would be used to collect the blood from the patient. So that is another term that you should pay attention to, the term bleeding bowl. It was used to collect the blood from the patient. Phlebotomy became a major therapy, meaning it was used to treat illnesses around the 17th and 18th centuries as, we were coming into more science and learning and discovering all these things about the body that we'd never known before. Lancets and flames were used to cut the veins and arteries. Those are important terms that you need to know. A lancet, you could think about what we use today when diabetics prick their finger. That would be a lancet. And then a flame, I'll have a picture that you can. So, another form of therapy that involves phlebotomy is cupping and leeching. So we're going to watch some videos about cupping and leeching in a minute. Let's see, right here. This is the flame. Oops, sorry about that. Flame. That is the flame. Yeah. Can you imagine getting cut with that? I mean, I'm sure looks dull because of time, but yeah, I don't think I would want to experience that right now. Let's go ahead and look over here. So this top picture here, right here, that is the bleeding bowl. And then here we have a picture of some leeches. All right, so leeching is the process where they will put milk or blood on a patient's skin to get the leech to go over there. So that the leech is going to basically drink the blood. It has an it has what is called a vasodilator. So vaso meaning vein, talking about our vascular system, okay? Dilator meaning it's making it bigger, okay? And then in local anesthetic, the anesthetic is that numbing. So what happens is that saliva of the leech, when it bites, the patient would not feel it, or the person, whoever has a leech on them, would not feel it. And those chemicals, those um, enzymes inside that saliva of the leech, makes the vessels of that area get bigger, so there's more blood flow, and it numbs the area too. And then it also has this Hiridan that's called, it's an anticoagulant. This is an important term you're going to need to know throughout this course. Anti meaning against or stopping. Coag has to do with clotting. And then we could just, the last part, coagulant, we'll put that together as clotting, okay? So anti-clotting. So our blood naturally clots. We have hormones and chemicals in our blood that will make it clot as soon as there's an injury. And we'll talk more about that in one of our other PowerPoints. But the term anticoagulant is against the clot. It is stopping the clot from happening. That is very important for you to remember. So then, getting back to the leech, once the leech has made their bite there, they will drink until they get full and then they fall off. And the reason why we use this today, we use it in microsurgical replantation. So it can help people reattach limbs. What is going on here, the reason why this works, is our blood carries all the components we need to heal ourselves. Okay? So even though our ancient ancestors may not have had it completely correct, they did know a little bit, because they knew if they drew blood to an area, it would help heal. And that's what leeching and cupping does. And we'll talk about that one, cupping, next. So with this microsurgical replantation, it's bringing, instead of clotting off and scarring and letting, the body is going to repair itself, okay? So if there's been an injury, it's going to basically scab everything off. And if it can't be reattached, it's going to make like a barrier, okay? So whenever they have this, leech is keeping that area, basically it keeps the tissue and the whole area fresh, so that tissue and area is not dying while they're waiting to reattach something. And then after these things have, limbs, skin grafts, all kinds of stuff have been reattached, the leeches also have the benefit of keeping that blood flow there as the capillaries and vessels refuse and repair and join back together. And then normal blood flow can resume. So, yeah, it is so interesting and awesome how, things that were used so many years before we can even imagine are still being used today. So, it's pretty awesome. So I'm going to pause right here because I want you to go watch the videos titled Leaching Part 1 and then Leaching Part 2, okay? And when you come back, I'll throw some information out there to you based on the video, and then we'll get into cupping, okay? See you in a bit. Okay, what did you think? How was it? I know some people may have been grossed out, but um, you are joining healthcare. There's some gross stuff out there. I hope you enjoyed the video. Let's talk about the guy and that spot on his leg. Yeah. Um, I believe he was probably diabetic and probably had some kind of injury to that area, and it had a hard time healing. And so you could see how those leeches over the couple days and that regimen, you could see how they brought life back to that tissue that looked like really awful to begin with. Yeah. I don't know. Could you do that kind of therapy? I don't know. I don't know if I could handle the thought of them being on there. I don't know. Yeah. So one thing to know about leeches, they do require prescription. And because, you're about to learn all about some blood, so we need to understand that when they are used for a patient, those same leeches would not be used again. Does anybody, can you think of maybe why they wouldn't be used again? So we haven't got into it yet, but later in this week's lesson, um, in one of the other PowerPoints, we're going to talk about infection control and bloodborne pathogens. And so, just like how we know mosquitoes carry diseases because they stick their beak in blood from everywhere, it's the same with leeches. We would not, it would be a safety concern, a health concern, if we were to put those same leeches on someone else, because that blood, if there's a disease process, I'm not sure which diseases would survive inside of a leech, but in theory, I mean, they've been around for a long time, so probably a lot. Um, so we would not want to transmit anything to anyone else. So those leeches, they would be kept through for the duration of that patient's treatment and then destroyed, because we wouldn't want to put that on anybody else, right? All right. I hope you guys enjoyed that and learned a little bit. All right, the art of cupping. So I don't know if anybody's familiar with this. I know more people were familiar after the last Olympics because there were a lot of Olympians doing the cupping. So again, it is that concept of if we draw the, I'm using quotes, you can't see me, good blood, because there's no good or bad blood. If we use the quote good blood and bring it to the area that is needing attention, we can help alleviate whatever disruption is going on. Okay. So this can be used for muscle aches, migraines, depression. Like there's a lot of uses that I've seen advertised for cupping. I know that um, I think I have not done the actual cupping. I don't think I would do wet cupping, which we're going to see the two different types. Well, there's several different types, but we're going to take a look at wet cupping and fire cupping or dry cupping. Um, I have some videos for that in a minute, but I do see, my point was I do see how it could benefit, and one day I will try it when it comes up. So, what this does, you're putting a suction basically. There's different methods to obtain the suction, as you'll see in a minute. And it's basically just bringing all that blood to the surface, kind of like a giant hickey, just to be honest. In fact, I'll tell you a quick story. My sister's mother-in-law was having cupping done for migraines, and she had some like on her neck and temples, and she was telling my nieces and nephews that it was a hickey, and to go ask their mom what that meant. It was pretty funny because they're really religious. It was hilarious. Anyway, so um, the you use a suction device to bring up that blood to whatever area it is, okay? And then for dry cupping is just when you use the suction, okay? When you make incisions of the capillaries with a fleme. Remember that term, fleme or lancet. We don't call it a fleme anymore. Everybody calls it a lancet. Which can be, there's different types of lancets. And then, so the incisions are made, and then the suction is applied. So it is bringing up all of that um, blood all the way out into, it bleeds into the cup. Okay. It will be a lot clearer once you watch the videos. Okay. So I am going to go ahead and pause right here and let you go watch Art of Cupping Part 1 and Art of Cupping Part 2. And then we'll come back and talk a little bit about the videos. Enjoy. Welcome back. Welcome back. What did you guys think? Interesting, huh? So I wanted to talk mainly about the wet cupping and how that was done. I know you guys have not gotten into our safety and universal precautions and all of that stuff, but did you guys notice some things about his procedure that was maybe a little not sanitary, not the method I'd want to use if I was the patient? Hmm. Yeah, we'll talk about that in class. Write down what you saw in that video that you would have been like, not me. And we'll talk about in class, okay? But the point I wanted to make with the wet cupping is I've heard a lot of benefits from it, but can you imagine? Because I have tattoos. I know what it's like when they keep going back over the same spot, and you're like, hit that spot again, I'm gonna hate you, you know? Um, but can you imagine the pain and suffering he must be in if he's willing to not only go have this done, what seems like it would be an exhausting, painful process, he's willing to get a whole patch cut out of the back of his head. He is not feeling good, and he must really believe in this method. So just keep that in mind. The reason, you know, it's always good to know the history of where your profession comes from so that you can appreciate where you're at. It also helps you be innovative in the future. Who knows what you're going to go out there and change in this field. So it helps to know where we've come from in the field. So the other point to this is so that we don't judge. You're going into healthcare, and we have to be open minded and kind of put um, a lot of who we are sometimes may not agree or mesh with other people, but we have to kind of set that aside and be like actors and actresses, right? Um, so that we can deliver quality care to people. And it's not always fun, but we need to be mindful too of people's belief systems. If we have someone who believes like this, I'm sure you have some family member that believes, the word Windex keeps coming to my head, but that's a movie. Like lemon and honey is going to cure everything. It's kind of like that. And we have to be respectful of that because when we dismiss that, when we make fun of those things, when we just don't acknowledge those things that are important to people, it breaks down the trust that we need to have when we're working with people in healthcare. Okay. So, and we'll talk more about those kind of things in a bit, but if you see someone with like these big red welts all over their back, in today's society, my first thought before, I really got to learn more about this would have been they're being beat and I need to help them. And, if I ask them if they're being beat and they say no, like I can create a whole story around these dark bruises on the back of someone if I don't have the education, right? So this is just saying we need to be mindful of cultures and traditions and other methods as long as it is safe and not detrimental and those kind of things. And we'll talk more about a little bit later about the things you'll encounter while you're in healthcare and how to handle those things. Okay. All right. So the goals and methods of phlebotomy today. So today we use phlebotomy to obtain a blood specimen for diagnostic purposes. Diagnostic is testing purposes and to monitor treatment. So we're not only trying to find out what is wrong with you, but we're also trying to make sure the treatment that we're giving you is working, right? We can also remove blood for transfusions at a donor center. In the US, blood that is used for donations, blood that is used for medical purposes to like save lives and things like that in the hospital, those are by donation only, okay? Those places that you see out, you know, I can't think of the names right now, but you know where you can go donate plasma and they pay you. Those are actually owned by foreign companies, and the blood is used for their vaccines, research, medications, all kind of purposes. But they pay you, and they are overseas locations. The U.S. does not pay for blood donations. We also remove blood for therapeutic purposes like polycythemia and hematochromatosis. So these are two terms that you do need to know. It is important to remember. Polycythemia. So we look here. Let's break these words down so that we can remember them, okay? So we're going to take the word poly. Bear with me here. So we have poly, right, and hemia, okay? So poly means many. Cyte means cells. And hemia means blood. Okay? So when you break down words that you don't understand into their medical terminology, it can help you when you're taking like your certification exam and things like that to remember and break down the word, and then you may be able to figure out the question once you break down that word. Okay? And then so we've broken down the word and we have many blood cells. Okay, so what polycythemia is an overproduction of red blood cells. Okay, so that overproduction of red blood cells creates widespread pain, fatigue. If you think about it, it's just too many for the blood to flow, and that blood is bringing us oxygen. So if we're not getting what we need because there's like bottleneck traffic, it's not a good thing, right? So patients with polycythemia will come in and get what we call a therapeutic phlebotomy done. Okay? This therapeutic phlebotomy takes off a prescribed amount of blood. So, like ancient bloodletting, right? So the doctor will do a CBC. Well, they'll come in. You will draw blood for a CBC. It will get sent to the lab. In their orders has the parameters. If their CBC is this, then they get the phlebotomy. If it's not, then they don't. Okay? So when they come in, they get the call, give them the phlebotomy. Okay? We take their blood pressure, check their pulse and their temperature. We have them sitting down because sometimes it takes a while, and we never leave them during this process. And they have really large bottles that are used to collect the specimen, because we're taking off about typically between 250 mLs and 500 mLs. And we use a needle that is a 18 gauge needle, so about the same size as a blood donation needle. We are not going to watch the video right now, but later you can go watch the video on polycythemia and therapeutic phlebotomy. Okay, so I'm going to go ahead and write polycythemia is an overproduction of red blood cells. Okay. Next, we have the word hematochromatosis. I have to say it fast or it won't come out right. Okay. So, the definition, this condition is when the body stores, basically collects more iron than it needs. So, this extra iron can cause liver, heart failure, pancreas issues, heart problems, organ failure, cancer, just a lot of different things. They're not going to be feeling very good. Okay, so let's break down the word. We have the first part of the word. Here we have hemat or hemato. You also see it spelled this way, heme. And this represents blood. Then you have chromat. This is color. And then you have osis, which represents disease. Okay? So the significance of the chromat, the reason why they talk about the color, and it's named, this disease is named this, because the iron causes the blood to look, be a deeper, different color. Okay? So then we have methods of collecting these blood samples. Okay, we have venipuncture, which is where we are accessing the blood through a vein. Is venipuncture. We are cutting a vein. Venipuncture simply means to cut a vein. Okay, and then we have the capillary puncture, and that is where we are using a lancet to puncture the skin, because as we get more in the next couple PowerPoints, we're going to look at the vascular system and what it looks like, and you'll see we have millions of capillaries, and when we make a cut at the surface, we are cutting millions, thousands of capillaries, and they're all bleeding together. So Yeah, and we will get way more into that as we go on throughout this course, okay? All right. Um, so let's take a minute to just think, and we'll talk more about this on Friday when we meet in person. But what do you think are some qualities of a professional phlebotomist? What do you think is important about a healthcare professional's appearance? And why do you think these things are important? Why do you think these things matter to a patient? And I really want you to maybe pause and take a second to maybe think, just a second to think about each of these questions from the perspective of what do you expect when you go into a healthcare facility. And that is how you should go into work every day and deliver the same type of service that you expect when you go, not how you've been treated, not how what you're used to, because if we continue doing what's been done to us, nothing ever changes. So keep that in mind. Listen, I've had to take more than a few moments to get myself together and remember um, that people have bad days. You know, when dealing with um, me as a patient, dealing with people being rude to me in the healthcare setting. So let's be the change. Let's change that and make a difference, you know? So the roles and skills of a phlebotomist. This is important for you to know because this is what you're wanting to go do, right? So a phlebotomist is anyone trained in blood collection. Many healthcare team members are trained in phlebotomy, but I'll guarantee you, you have going through this course, getting this certification, you have the perspective from what happens to the blood after you collect it. And that, and being professional, learning to perform the stick, the venipuncture, is a skill. It's manual dexterity, it's muscle memory. It's something that anyone can learn to do, right? But having this extra knowledge of why you're doing what you're doing allows you to adjust, think on your feet, figure things out in the moment and know what you're talking about above some people who, not above, but more than a deeper understanding than, I promise you, nurses. And we'll talk more about that on Friday. Nothing against nurses at all, but they do not receive this level of training about blood collection. And that is why a trained phlebotomist like you all will be in 6 weeks is so important to the career fields, so that you can help people learn. And I guarantee you, once you finish this course, you'll be out there. Once you get established, you'll be out there training and teaching people because you just have a deeper understanding of it. And that's nothing against anyone else. It's just that's your role. You got the position. Okay. All right. So you have to have good manual dexterity. And that's talking about your fingers and hands and ligaments around your wrist and in your connecting your fingers and your palms, and all of that stuff works. And it's not achy. I mean, listen, we all get achy, but you know what I'm saying? Like, you can do a repetitive motion, you can adjust, you can move your fingers around, you can get yourself in odd positions because, again, I have plenty of stories for you as we do labs about the crazy places I've drawn blood, okay? And it's fun. You need to have special communication skills. Um, this is so important because we do not know, even though someone may present quote unquote normal or neurotypical, that does not mean that's judging a book by its cover, right? You cannot assume anything about anybody. You need to, listen to their words, watch their nonverbal language. If you feel energy, feel their energy. You can feel when someone's scared or upset. You don't even have to like feel energy like that, but you can tell, right? It's our intuition. This skill comes so in handy whenever we're dealing with um, the public because we need to be mindful of the patient who may be homeless and not have good hygiene. And they're embarrassed to even be there. And they don't want to be there, but they have to be. And showing them compassion. Um, Being compassionate towards children who are on a spectrum and not forcing them and realizing that they're tiny humans and not forcing our will on them, making them just a part of the process as we would an adult. We'll talk more about handling those situations as we're practicing in labs, and we'll talk about scenarios. We'll talk about just being able to diffuse situations. You're meeting people, and we're going to talk about this more too. You're meeting people on their worst day, and being able to navigate through that is a special communication skill. Okay, you need to have good organizational skills. The lab can be busy. You can be working in a place where you're running all over the hospital drawing blood. I've done that. You can be covering floors and the ER and the pager. When those codes go off in a hospital, phlebotomy team has to be there. We are on call there with everybody else on the team. We're not always necessarily in there drawing the blood. Now, if you work in a small ER in a small town, yeah, you'll be in there drawing blood while they're pumping on their chest, okay? Phlebotomy can be really fun, but you have to have good organizational skills. I will tell you the thing in phlebotomy is timing because you have tests. We have tests that are ordered sometimes with time restrictions on them, or the doctor needs it ASAP, or the nurse can't let this patient have 5 minutes off of this really powerful antibiotic, or their fever is going to spike because they're fighting for their life, and you have to draw that blood before that antibiotic is hung to make sure that they're not toxic. And it's a timing thing. It's a beautiful thing. Once you get in your flow, it's fun. I like that kind of stuff, like just being organized and flow one thing to the next. I only organized it in work though. Anyway, that's where you have to have your time management in order, but also understanding the test and what can wait and what can learning how to prioritize. And that does come with experience. And I will tell you, you will leave with a good foundation and knowledge and have a leg up on people who just get on the job training and have to work it out. You need to have a knowledge of lab specimen requirements. If you don't know that blood needs to be put on ice and you draw it and you send it, they're going to be rejected. It doesn't matter. It had to be on ice. They're not going to make an exception because it would affect the test results. So you're going to get all of that knowledge here. And don't be worried because when you get on a job, every job has about a month of orientation. And you have a checklist of stuff that they want you to learn and do, and they teach you their way and how they expect it to be done. And you don't get turned out on your own until you're signed off on those things that I feel comfortable doing them alone. Okay. So don't worry. It's a lot of knowledge, but all we're doing right now is planting the seeds for you, and you will develop and bring out those seeds and grow those seeds in your career. Okay. So you need to have, again, standard practice. Like, what is standard across most labs and doctors' offices? Does that mean everyone's going to be that way? Oh, no. But you will have a good idea and foundation, or you should have a good idea and foundation of the basics. You need to have excellent customer service skills. Healthcare is a business. A lot of funding and stuff is based on your satisfaction rate. So having those excellent customer service skills, talking about turning a person's day around, understanding your job so that you can give outstanding customer service. Understanding that, okay, you were a hard stick, we didn't get the tube full, but I know for this test that's not necessary, so we're going to go ahead and let you go. Or I know for this test I can use a finger stick, so we're not going to poke you anymore, we're just going to use your finger. That is the knowledge that you're gaining here. That is a thorough understanding of your job, what's expected of you, the standards that you should bring with you. Okay? And we will develop all of these things as we go. These things that I'm talking about, understanding your scope and standard of care, customer service skills, all of these things you will get in small pieces as we go through the course and as we work through the lab. Okay. And it won't be like, hey, this is a scope of practice or a skill, unless it's on, I believe it would help you with your certification or a test you have. Okay. Otherwise, these are things that you're just habits and things that you're going to observe, make it your own, and make it part of who you are as a phlebotomist. All right. So, this is where I was talking again about when we deal with patients who are ill or irritable, being confident and professional in your appearance is most helpful for them. Um, Remember, we're seeing people typically on their bad days, on their worst days, right? And so just think about yourself. If you're having a bad day and you're there to get some maybe blood drawn to find out some test results that are going to be life changing for you, do you want someone coming in like they don't know what they're doing and they just got off their phone and have like not checked back into work yet? That feel, like you kind of, we we flow between different things in our lives, right, throughout the day, and we can be on the phone or chatting with our friends and then have to get back in work mode, like, oh yeah, this is the process, this is what we're doing, right? um and I'm not talking about you can't be, I'm not harping on those kind of things. I'm just saying, when you walk in that room, when you go call that patient, make sure you have your work face on. Make sure you're in your work energy. Make sure you've clicked back over and you're ready to help and listen. Okay? If you had a bad lunch, take a minute. Like I tell my students, like you knock on the door before you come in, leave that juju outside. Like we come in here fresh, okay? If you've had a bad day of like can't stick, like can't hit the broadside of a freaking barn, I get like that all the time. And take a step out, go get the fresh air, go take a breath, go get a drink of water. And normally that kind of resets like whatever was going on and you get back in your groove. Okay. But being confident, part of that is if you get asked a question and you don't know, don't say, I don't know. Say, I'm not sure I have the right answer for you, and I don't want to lead you wrong. So let me find out for you. Don't leave patients hanging. Don't leave people hanging. Try to help them if you can. Okay. Um, Saying I don't know is not, I'm not going to have a lot of confidence in you. And the patient healthcare professional role, trust is so important. Okay. And this is going to be something that I'm going to talk about a lot throughout your course, because if you can learn to develop that relationship with people, and I'm not always a people person, so I get it, but if you can learn to do that, you're going to have patients that love you. You're going to have people who let you practice, who let you mess up, and you don't feel bad about it. You know what I'm saying? All right. Another reason why it's so important for the phlebotomist to have a good contact or interaction with a patient, because, and this is important to know, this is something that is, I've seen it come up in a lot of tests, but the reason why It is important for this relationship to have trust, understanding, positivity, is because you are often the only interaction they have with the healthcare facility. And so they will associate that entire facility with their interaction with you. And that is on some tests, okay? So it's important to remember that the patient often gets their idea, their opinion about a facility based on their interaction with you, the phlebotomist, because that's the only interaction they have with the facility. Okay? People may judge and not come back, or the reviews, send in letters, all the things, right? People are here not always because they're well, and we don't want to make it worse, right? So our goal is to always put the patient at ease and establish a positive relationship. Okay. We have to be mindful of the beliefs and values that people have, needs based on their environment, customs, traditions, and attitudes towards seeking help from healthcare providers. Okay. This is talking about, if you are a male and you're dealing with someone who is deeply religious and not allowed to speak with other males that are not family members, we're mindful of that. We're not barging in their room. We're not, we're not bothering them. We're not making them uncomfortable. Okay. We have to remember there's some people who they don't go to the doctor at all. And it's a miracle we got them in. So are we going to be like blasé and sticking them 50,000 times and not like, hey, I didn't get this person, let me go get someone else, we have to be mindful. Granted, I mean, tattoos, I have tattoos. I am of the, hey, everybody's got them, we should get over it. But does that mean if I have an older person who it's deeply offensive, I'm not going to try to cover it up a little bit? I don't need to teach them a lesson. They're older. They've lived their life. They've had their lessons. I don't need to teach them a lesson. Okay. My lesson to them is compassion and love, right? It's caring for them. That's why I'm in healthcare. So we don't always have to take a stand. Sometimes we can just sit back and like they don't get it, and I'm not going to change their mind. So I'm not going to change my mood and get upset because I can't change their mind. Okay. Um, it's being mindful that someone may not fit in a phlebotomy chair because they are too large. And we need to make accommodations for that. We need to help them with that without calling them out or embarrassing them. Those kind of things. Those kind of things set you apart from the rest.
All right, some qualities of professionalism. We're going to get more into this as we go through our labs, but um, mainly keeping a professional appearance. We'll talk more about that, what that looks like when we're in person. Self-confidence, knowing your job, knowing what you're doing, having integrity, compassion, self-motivation, and dependability. Um, Being professional in the workplace will just set you apart from others. Okay. Patient rights. So it's been found that patients who are informed about their treatments and prognosis are considered in the decision-making process are more satisfied with their care. So this is saying when you go in a patient's room or you encounter a patient, you're going to tell them what you're doing, why you're there, who you are, where you're from, what you're doing, what they can expect. And you're also going to be asking them permission to do this procedure, testing, whatever it is. Okay. When patients feel included and feel like they have a choice and they feel like they are having things done for them, not to them, they tend to have a better, more positive experience and more satisfaction. Moving on to confidentiality. Patient information must be kept confidential and private. Ethical standards and laws enforce confidentiality. I'm sure we have all heard of HIPAA. It stands for the Health Insurance Portability and Accountability Act. We'll be talking more about this later, but you do need to know what that stands for, what HIPAA stands for, Health Insurance Portability and Accountability Act. This provides safeguards for confidentiality of protected health information. You need to know what protected health information is. Protected health information is any information that can identify a patient. Anything that sets them apart. It could be something as simple as the 100-year-old man that lives on Lancashire. Well, we know there's not many 100-year-old men that's probably going to live on the same street unless they're in a nursing home, right? So we wouldn't want to disclose that information. And in our supplemental materials, I'll be adding a paper that I created for the office that I work at, that gives a pretty long list of things that could be considered protected health information. All right. The Health Insurance Portability Accountability Act provided the standards for electronic exchange of information of this protected health information. So that means you cannot be sending someone's medical record over your Gmail account unless it is a HIPAA secure account, those type of things. You can't be faxing a medical record or test result or information to someone's Kinkos, that's pretty outrageous, but you never know. It also lets sets the standards about informing patients of their rights and what they can do if their rights have been violated, if their protected health information has been violated. Disclosure of protected health information does require a written authorization. This means when someone calls to get his wife's pregnancy results, you cannot give that information. And we're going to talk more about that in one of our other modules. We're going to get really detailed into those type of things, okay? Communication. This is the means by which information is exchanged or transmitted. So we have different forms of communication. We all know we have verbal, we have nonverbal, our body language, and active listening. So kinesics is the study of nonverbal communication. That is a term that you should know, okay? Proxemics is the use of space. So that is another term that you should know. So proxemics would be like your personal bubble, how close you are to someone. And then other parts, like getting in someone's field, you can feel when someone's standing a little too close. That's proxemics. And then appearance and touch. So their facial expressions, how they're touching you. That is a nonverbal communication. So it's not always about what you say, how you say it, right? And I can tell you to have a nice day and then have a nice day. And one of them can convey that I really do hope you have a nice day, and the other one can be telling you to go shove it somewhere, right? So let's be mindful. I know I always get told I have resting B-word face. I get told all the time. So I try to be mindful of that a little, my energy, what I'm putting out there. But I do get lost in concentration, and I promise I'm not as mean as I look. But that is nonverbal communication. Even though I'm not feeling negatively, I'm focused in my body. My energy's like, don't distract her because she's not going to get back on track, basically. But our patients don't know that. So I have to be, my students don't know that. I have to be mindful of that. And we need to listen. I know what it's like to my face says what my mouth can't. Just being aware if you're like that will go a long way. Okay. Elements of effective health care communication. Empathy. Empathy is feeling what the other person is feeling. And sympathy is just feeling sorry for them, just kind of like on the outside. But empathy is like you feel it. Like they're crying, you're crying. You can feel, right? Um, Control, making sure that the patient feels in control and that you feel safe and in control. And the control is not one over the other. It's a mutual beneficial relationship, right? Then we have respect and confirmation, trust. You can change a person's perspective and perception of your facility for the positive or negative, and you can change their day with a 5-minute encounter. Um, Listening is the foundation of good interpersonal communication. And when you'll find that when you listen carefully to what is being said and watch for their nonverbal cues, you're going to build a mutual trust with them because you're going to pick up on what they're not saying, right? And then you can also get to, often when we're in pain or we're not feeling well, we're not saying what is actually wrong. And you can get to the bottom of what is actually wrong by watching those nonverbal cues. And this is also especially important for you as phlebotomists, because we have patients who hype themselves. Our mind is very powerful. And people, when I say hype themselves, I'm not placing blame on them. I'm saying that their mental state and anxiety over getting their blood drawn can cause them to pass out. And you have to be, mindful of your job and watching those nonverbal cues going on with that person who's like frozen stiff, and then all of a sudden they're passed out on you, okay? So that is part of our job as a phlebotomist, watching those things, also soothing that anxiety, and that comes with, if I come into the room and I've forgotten half my supplies and someone's already anxious about getting their blood drawn, they are not going to trust me, right? And I struggle with that because I can be a little free flighty person sometimes, right? So I have to be mindful that if I'm coming in like that, I'm at least talking to them and letting them hear my confidence. You get what I'm saying? So there's a lot that goes into interacting with patients, making them feel comfortable, and getting that successful venipuncture. But although it seems like a lot to remember right now, you'll find once we start doing labs, like this will start coming natural. It just feels like a lot right now because you haven't incorporated it. But once you get all the pieces and then you start practicing the pieces, you'll be a pro by the end of 6 weeks. All right. This is the last slide for this PowerPoint, and it's talking about no one cares how much you know until they know how much you care. You've got to get people's buy-in and confidence in you, and that starts from the minute you call the patient's name, from the minute you take the requisition form and start doing your job. You are portraying that confidence, that professionalism, building that trust with that patient, and you'll be excellent. All right.